So the first question that I would ask you, and that you can see on the screen, that please tell us about your work as an integrative therapist, because dementia, there is different types of therapy. There is non-medical therapy, there is medical therapy. So can you just share some of, can you just tell us about your work as a dementia care specialist, and how you work as an integrative therapist?
Firstly, let me thank you for inviting me over, and I'll be more than happy to share, the experiences of the past and what we can do to improve the quality of life and well-being of those already diagnosed or living with dementia and their families and caregivers, whether they are hired or professional. As an integrative therapist, I feel that it's important to know what is integrative therapy. It's actually it's a mixture. You take the best of all the therapies, put it together, customize it, and use it according to the person living with dementia is going to be subject to. So professionally, I feel a person-centered approach is the best, during which the first thing is assessment of the family background, the interests, the medical history prevailing at that time of the assessment and the past, and also their personality. So after we get this information, the during the clinical therapeutic assessment, a customized modular sessions are planned, and after every session, if not after a couple of sessions, we modify them so that there is a change, a positive change in the lives of those living with dementia. And I think, we never give up on anything. And earlier, the better it's detected and intervention done. And more importantly, I think once the assessment is done, there's no need of being scared, because there are a lot of organizations who do this work, and we are always at RC Mumbai chapter. We are very, very active. We are receptive to people's challenges, and what we do is we have a lot of empathy for people having a family member with dementia. So we kind of sensitize them more. So that's what I do as a professional integrative therapist. And more importantly, I think, even though sometimes often I think integrative therapies do work, but the group therapy is very, very exciting, because they have a socialization in that group therapy, which we do at the daycare center. And they enjoy coming out, spending time away from the normal home atmosphere. And that is what I do. Various kinds of therapies. You have exercise, you have cognitive therapy, you have music, dance and movement, doll therapy. There are many. And I think, when one is very creative, I think we create more and more situations. So that is what integrative therapy is about. And I have had very positive experiences where, it's used as risk reduction and also for delaying the progress of the disease if one has been already subject to it.